Hi, everybody. I'm Brad Pike, the mayor for the city of Eagle, and I have a special podcast today. We're coming to you from Ada County Victim Services here in downtown Boise. And we have Sonia, Trina, and Ann, and they're all going to introduce themselves. But first of all, I just wanted to say what a privilege it is to meet with you guys and let you tell us a little bit about this special center and exactly what you do for the citizens. So, Sonia, how don't you starting out?
Thank you. I'm Sonia Howerton. I'm the Executive Director of the Idaho Network of Children's Advocacy Centers. We're a statewide nonprofit association-based center that serves to bring together the children's advocacy centers within the state and the first responders that are connected to each of those children's advocacy centers. We work with law enforcement, prosecution, child protective services, medical and mental health providers within the state of Idaho to provide best practice response when there are child abuse allegations.
Awesome. And Trina?
Yeah, so my name is Trina Allen, and I'm a licensed clinical social worker, and I'm also the executive director for the Ada County Victim Services Center. So here at the center, we have wonderful partnerships with many community providers, including Sonia, the Idaho Network of Child Advocacy Centers, and we really provide a safe place for victims that have experienced sexual assault, domestic violence, elder abuse, child abuse, human trafficking, and stalking. So thank you for having us today.
Heavy stuff right
Yes.
there. Yeah. And then Ann.
Yeah, first, thank you so much for coming to the center. It's
You're
exciting.
welcome. It's great.
My name is Ann Wardle, and I am the nursing supervisor for the Ada County Community Safe Team, which is a team of nurses available 24 hours that respond to anyone who's experienced sexual assault, rape, or domestic violence within our community.
This is heavy. This could be a heavy subject today, but we need to get it out to the public, and we want to get it out to the public. So Trina, I'm going to ask you first. Can you tell us about the Ada County Victim Services Center and the people that you serve?
Absolutely. So the Ada County Victim Services Center, or what we like to call the center, is a really special place. I think it's really important to know that we have been serving our community since 2006. And located in our center, we have multiple community partners. So that includes St. Luke's, a partnership with St. Luke's, as well as St. Alphonsus, the Idaho Network of Child Advocacy Centers. We also have a partnership with all of our law enforcement providers. We house the Boise Special Victims Unit. We also have our accredited Child Advocacy Center here on site with St. Luke's. We also have mental health providers with Terry Riley, their trauma and resiliency counselors, and we also have Tonta Incorporated. We also have a strong relationship with the Department of Health and Welfare, and we also have a strong relationship with the WCA. In addition, we have a relationship with Idaho Legal Aid and Family Court Services, the prosecutor's office. So really, this center is based on a justice center model, and the purpose is for when folks have experienced something like a sexual assault or a crime, then they have one shop, I guess it's a one-shop stop is what I would say. It's really important that our community knows that they can come through one door and access multiple services. So there's so many important things that happen here, not only just because of the medical exams that can occur, that we're open 24/7, that you can access multiple different partnerships, but also we have the ability to provide things like gas and food cards, clothing with Joanne's Closet or the Cares Closet. We are able to do things like if there's an unsafe situation, maybe somebody might need to have a track phone or different items to help sustain that family for a period of time, as well as ensure their safety.
Right, Trina. Can you share with how the center has impacted someone's life?
Yeah, absolutely.
So recently we had an event where we were contacted by the Department of Health and Welfare. They needed some crisis counseling for some children that just experienced a huge loss in their life. And at that time, Terry Riley was just moving into the building. Their offices weren't quite set up, but I went to Brittany and I said, gosh, we have a situation. Is there any way that you guys would be able to provide some crisis counseling? And they were like, absolutely. Although their offices weren't set up, we were able to put them in a couple of our soft rooms. And the counselors met with the girls. The kids. I get a little bit choked up because it was so powerful. And the counselor was able to meet with the children and kind of talk them through a pretty horrific experience. And afterwards, the young man said, I would like to just take a shower. And so we were able to let him go into Joanne's closet and take a shower and get some new clothing. Those kiddos were going to have to go to a different place to stay the night. And I know that moment in his life, it was just so touching that we were able to meet the needs in that very moment for him. He probably will never remember taking a shower here or the fact that he got new clothes, but the fact that we were able to be here, to have services wrapped completely around him, to provide something so simple like a shower, and to provide something so simple as a pair of clean clothes and some shoes, meant a lot. And I know that it meant a lot to him in that moment.
And that's kind of special because you remember it.
Yeah, absolutely.
All of the people that were involved with that situation remember it. So it still impacts us as human beings with our compassion and our want for somebody to be fixed. And you can't fix them, but you're trying to do whatever it is to get them to that point of comfort, I guess. So, I mean, it is emotional. It's going to be, and I said, all of these questions that come up, there's going to be a point where we all have some memory that's triggered and it's going to be, impactful. But I think that helps stress the importance of what you guys do for the community and how it does affect all of us as a community, not just the individuals sometimes. And we need to make sure we understand that. So let me move on to some of the things. Sonia, let me ask you, tell us about the Idaho Network of Children's Advocacy Centers.
The Idaho Network of Children's Advocacy Centers is a statewide nonprofit. We're the accredited state chapter of the National Children's Alliance. And we're a membership organization that is made up of the children's advocacy centers within the state. In the Greater Treasure Valley, we've got St. Luke's Cares, which is our largest children's advocacy centers, in the Nampa Family Justice Center. And we're an organization that serves to provide support and network amongst those CACs to help provide best practice response when there are allegations of child abuse. They're obviously providing the direct service for the children that are coming and seeking the care. But then we at the state level provide additional support and services to help bring together MDT partners through law enforcement, child protective services, prosecutors' offices, medical and mental health practitioners, and we also then additionally provide training and access to other resources to help them so that as they're focusing on the children, we can help them with some of the other training and technical assistance.
Now, I know you work behind the scenes with law enforcement and social workers and stuff, but people sometimes misunderstand the work that these first responders do. So can you give us a little bit more in depth of actually what happens and how the interaction with these people, especially from your perspective, probably?
Yeah, I think the biggest misconception is that many people think that the first responders are there to take the kids away, and that is not the role at all. They definitely have a very heavy job, and it's emotionally taxing, and all of them are extremely committed to being there in the time of need for our kids within the state. And so, as the network, we really stand to support the work that they do and wholeheartedly just, really support the fact that the child is going to get the best service and is going to get the opportunity for their account of the abuse to be heard and have the best chance for justice through prosecution when that case is handled through that team response with law enforcement, with prosecution, with Child Protective Services at the Children's Advocacy Center, because then the Children's Advocacy Center can do the rest of the wraparound services and make sure that the child is connected to the services to make sure that they're healthy and to make sure that they have hopeful outcomes for the future through mental health services.
Awesome. Now, first, what can the citizens of Idaho do to help support you?
Awesome. I think the best thing that Idaho citizens can do to support the work that we do is to definitely be an advocate for kids and recognizing that child abuse is happening in all of the areas within the state in every single community, and that we really just need to be vigilant. We are a mandated reporter state with the exception of clergy. But if you see something, we encourage you to say something by dialing 211 and reporting that to either Child Protective Services or definitely, depending on the urgency of the case, to call local law enforcement so that those cases can get in, those children can get the services through Children's Advocacy Centers.
All right, Ann, we're coming back over to you. And I'm going to ask you about the Ada County Community Safe Team versus Safe or SANE.
Yeah, so the Ada County Community Safe Team is a group of nurses that have gone through specialized education and extra clinical training in order to provide medical exams for anyone who has experienced sexual assault, rape, or domestic violence. The difference between a SAFE and a SANE, there's not much, it's just acronyms. So SAFE can be anybody who performs the exams, sexual assault forensic examiner,
Okay.
and a SANE strictly refers to a nurse, sexual assault nurse examiner.
What services do you provide, and how can people access those services?
The services we offer to the community are for anyone who's experienced sexual assault or rape within the previous 5 days or 120 hours. They can come in to the area ERs or the center and request a sexual assault medical forensic exam. We do also offer medical forensic exams for domestic violence patients. There's a stipulation you have to be working with law enforcement to be eligible for those,
Okay.
because in Idaho, everyone's a mandatory reporter for domestic violence.
Okay, and what can somebody expect during those SANE exams?
So when we are first called out on an exam, we meet with our patients, we introduce ourselves, we explain their options. There's a couple options available to patients over 18 years. We do see patients 14 to 18 and then 18 and above. So the adults have a few more options. And then once we explain their options, they get to make the decision of what they want and what they don't want. And all through the exam, our patients also can decline any portions. Part of what we do is putting control back in their hands, because through sexual assault and rape, their control was taken away. And so the exam consists of a medical history, and then we ask them about the assault. They should provide details about that. And then they can have a physical exam where we do a head-to-toe assessment looking for injuries, and we document those.
Mm-hmm.
And then lastly, they have the option to have a sexual assault evidence kit collected. And so that's something we'll do during the physical exam if they wish to do that. You can have a SANE exam without kit collection.
Okay. Well, just listening to this is a little bit powerful, because the victim has to relive the incident kind of again with the examination sometimes. And I can only imagine that has to be not only for them, they're already victimized, but how do you deal with it as a person, but you're a professional in that realm. But I mean, sometimes it's got to be hard and having support, because are you one person that is in the exam room at a time, or do you have support staff that's with you, or is it because of confidentiality? Uh, how does that unfold? Not without getting too detailed, but I just think the burden is pretty heavy when you get into having to relive an event that just you want to get away from.
Absolutely. Our primary concern is to not re-traumatize our patients. We ask questions a little differently than you would normally. And for certain exams, we are alone with the patient throughout the entire thing. For all physical exams, we're alone with the patient. They can have a support person in there if they would like. So often patients will take advantage of that. For how we deal with the stress, I think most nurses have to have quite a bit of experience to be on the team as nurses. So we've learned how to do that before they've come on the team. But we have quarterly team meetings where it's confidential and we get to talk about everything. My office is always open. They can come and stop by the office and we talk about it. Phone calls late at night. We have a group chat. We find ways to make it a little bit easier.
Coming from my background, we get on scene of an event in the medical world, and it is way beyond our scope of practice, and we don't get the opportunity to understand the dynamics. We kind of load and go, right, to get to them to you guys for these situations, and of course have conversations with law enforcement. But the critique part, I think, has always been critical. So it's good. I'm interested in the fact that your mental health is also coming into play. Even though we're professionals, we kind of suppress calls sometimes and do those things, but we're all human, right? So they're going to surface back up once in a while. But to have a venue to where you can do that, especially if you're the lead and you're the boss there, and you have to make sure everybody else is doing okay, so you look for those signs and things that are a little bit off. So I guess it's important for me to have you guys explain the fact that when this is extremely sensitive subject matter. It's extremely traumatic on whoever takes place with this. But one of the things too is I'm interested in for the first responders side of it. We get a moment in time, maybe 10, 15 minutes of it, and then we're done. We have no closure on it. And sometimes it gets to the point where now you've taken over, you get much more detail in it. But that closure part also, you got to play the professional realm, but as you're a passionate, compassionate human being, you're wanting to make sure that it's all getting addressed. So I think that's vital when you guys are providing your services, that the dynamics behind all of that is people forget you need the support just as much as the people you're providing the support to. So explaining that part was important, at least for me to get that out, is that you just don't take care of the person and just go back in your office and go, I got to deal with this on my own here. So that's the critique portion. I think is extremely valuable in interaction with others. So that's to me, that was an important topic for you to answer. So I appreciate that. All right. So as we wrap up this podcast with these wonderful women, I want to give them an opportunity to say something in closing that you may have thought during the podcast, or you just want to get out there to the public. So Sonia, why don't you give us a final recap of what you're thinking?
I think the big thing is that if you suspect child abuse, it's great to turn that over to the professionals. I think everybody that is in this building and all the professionals that are working hard on the cases are some of the best people I've ever met in all of my career. I think that they're dedicated, passionate individuals that are ready to put the individuals first and to kind of get to the core of what might be going on and to help individuals see health and healing in cases where, there's services that can be provided.
Are provided between 8 and 5, but if you have been a victim of sexual assault or domestic violence and it is after 5 o'clock, you are welcome to come to our door at any time. And that's really important to know. I think the other thing that is important to know is an exam, and Anne can speak to this, but it's free of charge. The services in-house, there are multiple different ways that they're funded, and so I don't want to be a barrier that people think, oh, I can't access service because I can't afford it, and that is absolutely not the truth. I think it's really important for people to know that we're downtown Boise at 417 South 6th Street. Our phone number is 208-577-4400. We are on Facebook, we're on Instagram, we're on LinkedIn. We have a multitude of services. Anybody who is curious to check those out. If you are even on the fence of like, I'm not really sure if this is abuse or I don't know where to access a service, give us a call. Hey, if we don't have it, we're going to get you connected to where you need to be. So that would be the message that I'd like to send.
Medical forensic exams are available 24 hours a day, and you can request our services a couple of ways. You can walk straight into the center and request a SANE exam. You can also visit one of the local ERs and also request an exam. You can also call 911 or the non-emergency dispatch number for Ada County and directly report to law enforcement as well. I want you to know that we, the SANE nurses, are here to support you in whatever decision you make. If you come in and we talk to you and you don't want us to do anything, we don't do anything. We allow you to make those decisions for your healthy recovery.
You guys have hearts of gold, I can tell already, and you're passionate about taking care of people, and that's an important tool on this whole thing. But getting it to the public through mediums like this, I think it's going to be vital to help bring that and spread that out even further and get more communities involved to understand, hey, these people out there, they've already had this traumatic event happen, but they're not alone in it. So they have resources that they can utilize to bring it to them. So we're going to close on that right now. We appreciate all three of these women really opening up and being very candid with some of their information given.
Thank you.
Thank you, each of you.
Thank you.
Thank you.
Yeah, thank you.
I'm Amy Barton. I'm a child abuse pediatrician, and I'm the medical director of the CARES program with St. Luke's Hospital. And right now we're on the CARES side of the building, and this is our CARES closet, and this is in collaboration with the Assistance League of Boise. They are incredibly generous donors who have created this organized closet. You can see it's organized by girls and boys and by size of clothing that they might need. These wonderful volunteers, they come by and they stock it for seasons. So we get winter clothing for the winter and spring and summer clothing for the spring and summer. And it's a great thing. Some of our kids come in, and sometimes if they've been a victim of a crime, they actually have to have their clothing collected for evidence. And so we're able to provide them with brand new clothing. But we also have some children that they just might not have a winter coat, for example, or might not have clean clothing at home. And so we're able to provide them with a couple of different outfits. We have shoes of all sizes. And then another great thing that we have here is we also have up here on the shelves, we have some bedding, and that can go to children who maybe potentially were victims of a crime that occurred in their bedroom, so we can give a bedroom makeover. And then we also have suitcases in collaboration with Jessica's Trunk, which is a nonprofit established by Dr. Matt Cox, the other child abuse pediatrician here in Idaho. And we provide a large variety of suitcases. These are just a couple of them for children who might be needing to move between homes because of a safety concern for domestic violence, or potentially also maybe they're also being placed out of the home into foster care or another placement. And so instead of having to take everything with them in a trash bag, they actually have a nice new clean suitcase to take their items with them. This is our waiting area for CARES. You can see this is a very child-friendly space. We have these light fixtures which look like clouds. We have this fun bubble wall for the kids to look at. This TV was just installed today, which will have things such as nature scenes and things for the children to look at. And then we have a saltwater tank. The kids get a lot of joy looking at that and trying to find the fish. There are fish that look like the fish from Finding Nemo in there, and so the kids get a lot of joy looking at that. But as you can see, it's a very child-friendly place. We want the kids to feel comfortable, and we want them to feel like it's not a sterile environment, even though it is a doctor's office. When children may have been a victim of a crime, instead of them being interviewed in a traditional sense, like a law enforcement officer sitting and speaking with a child, there is a child-friendly interview technique called forensic interviewing. Our interviewers work for St. Luke's, and they go through very rigorous training. It's an evidence-based method for speaking with children in a neutral, non-leading way where things are never introduced to the child, such as a perpetrator's name or a specific act, but it just gives the child time and space to talk about anything that may have happened in their own words. And like I said, words are never introduced. This is the interview room for our younger children, so there are bean bags for the children to sit in. And we also have hand fidgets and markers and crayons and things for the children to play with or draw with while they're speaking, if that makes them more comfortable.
Hi, I'm Ann Wardle. I'm the nursing supervisor for the sexual assault team here in Ada County, and I'm here to show you one of our soft interview rooms. We furnish these rooms with comfortable furniture in order to make our patients feel more at ease and to help them with revealing some painful details about their assault. This is our exam room where we do our medical forensic exams for sexual assault, rape, and domestic violence. Once we're in here with our patient, we have everything we need, so we don't have to leave the bedside. And on average, an exam for sexual assault or rape takes about 30 to 45 minutes, and then a domestic violence exam can take maybe an hour, depending on their injuries.
So this is Joanne's closet, and all of this clothing is brand new. The clothing is meant for men or women who are leaving an unsafe situation. We also have personal hygiene items, as well as undergarments, socks, shoes. We